Recording in progress.
All right, Ra, we're gonna get started. So I'm gonna have Donna comes up do the intro, okay?
Hello and welcome to today's webinar with eLotus. My name is Donna Chow and I'm your host and your moderator. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source of premium CEU content with over 250 speakers, 900 courses, and 3,500 hours of continuing education. Today's webinar is special because we ran a Watch It Free promotion. So we actually have 3 groups with us today. Our first group is our Watch It Free group. And if you are in this group, you use the code to gain access to today's webinar to audit the webinar for free. The video replay and CEUs are not included, but you can upgrade to our second group, which is our paid group. Paid attendees can watch today's webinar as many times as they want for the next month and earn CEUs. And finally, our third group. If you want to upgrade to our ultimate and final access, you can join our third group of Gold Pass members. I'll go into more details later today. But for the duration of their membership, our Gold Pass members do have access to live webinars and distant learning courses. All right, today's class is 20 practical expert-approved formula strategies for all herbalists with Laura Vasallo. Class will run from 10 a.m. to 1 p.m. Pacific time, and we will have 1 break. Allow me to highlight some important Zoom features before we begin. The chat room is first. If you can, please set your chat preference to everyone right now so that everyone can see what you're writing and be part of the conversation. Secondly, please type your questions for Dr. Vasallo in the Q&A box. Please limit to questions only so that we can keep this as organized and efficient as possible. And finally, for those who qualify, your CEU quiz will be ready the following workday, and I'll send you an email out when that's ready. Dr. Laura Vasallo, who has been in practice since 2000, is our speaker today. Dr. Laura is a compassionate and dedicated physician who strives to restore the tradition of the caring healer, one who knows and understands their patients, not just their disorders, because the goal of the treatment, in addition to relieving the main symptom, is to restore overall harmony and health to the individual. We are delighted to have her share her knowledge with us today, so let's get started. Dr. Laura, could you please share your screen now and your PowerPoint?
I'm trying. There we go.
Got it. Thank you.
Okay, you're welcome. All right, I'm on. Yes. Hey guys, I want to welcome you and thank you so much for attending this webinar. I have a special thank you for Donna for being so patient with me, to Sam, Rena, and Dr. Tina, because they have been so patient helping me get this webinar going. So today I'm going to be going over 20 collection formulas that I find useful in my practice. I actually use them on a weekly basis, if not weekly, definitely monthly. So I like to go over them and teach you on some simple ways of how to incorporate them. Let's see. All right, so these are the formulas that I'm gonna be going over them. Again, I'm gonna go briefly over them, and again, in a very simple format. I like to keep things simple. I don't like to complicate things. And I think that kind of works in practice because it makes it easier as the practitioner too, and for the patients too, if you could keep it simple for them. I've geared this webinar for those who are either new to acupuncture, new to practice. Perhaps you have a limited budget. You have maybe limited space. Maybe you don't know a lot of the herbs and you don't know where to start. Or perhaps you've been in practice for a long time and not sure where to start with the herbs because sometimes it gets complicated. By the end of the webinar, I hope that you have found this information pretty useful and beneficial and of great value. And that maybe if you haven't incorporated a lot of herbs, that you have the confidence that you'll be ready to and maybe place an order today or maybe place an order on Monday and start using some of these herbs right away in your practice. Because I believe that you have the confidence once I go over them in this simple manner. At the end of the seminar, the end of this webinar, I'm going to go over some helpful tips that may help you also in practice. And I'm going to go over as well some objections that I have found that patients have when it comes to incorporating herbs or adding herbs to their treatment. I've started to see a pattern over the years that they have the same objections when they have an objection or they have a question or they have a concern. So at the end of the webinar, stay to the end. So at the end, I kind of have noted down what their objections are and simple ways of how to address them. So that way you're not, kind of like more stressed out when they have these questions and you're not really sure how to address them. I feel like if I can help you with that, that's going to be easier for you too. So these are the top 20 formulas that I find useful in practice. So we're going to be going over those. And if it's okay, before we get started, I'd like to tell you a little bit about me and how my practice came to be and how I am where I am today. That's me. My name is Dr. Laura. My patients call me Dr. Laura. It's much easier than trying to call me by my last name. I have a practice called Natural Approach. So like Tina said, I've been practicing for 22 years. I actually started school in 2000. I actually graduated school in 2000. I was pretty young. I went to massage school first, did my college, and then I did acupuncture. So I graduated in 2000 when I was only 24. And in 2001, and I went to school in Miami. And in 2001, I moved to Melbourne, Florida, which is still in Florida, just about 3 hours away from it. And at that point, I wanted to start a practice. And I knew that either I couldn't be hired or there wasn't going to be a job for me to apply. So I knew that I had to start on my own. And I figured that if I went to school for that long, I had to start practice right away. So I called a bunch of chiropractors and I found a couple that were willing to help me since I couldn't afford a rent at that time. So I started renting space from 2 chiropractors who allowed me to pay a percentage. So instead of paying rent, I was able to do a percentage. And that really helped because it kind of took away some of the stress of trying to start a practice and not having the budget to actually pay for things. I did that for about 3 years. And then after 3 years, I figured that I can try to be on my own. So I found a space that was probably about 600 square feet or something. And I worked there for about 6 months. And then my goal was always to expand my practice. And I knew that if I wanted to expand my practice, I would have to see more than one patient at a time. And the only way to do that is if I had an office that had more than one room. So I took the risk and I got another office that had 3 rooms at this point. And then I had to hire a receptionist because I couldn't do it on my own anymore because it got a little bit more complicated. So at that point, I had to actually teach myself how to see more than one patient at a time, because I'm not sure about you guys, but when I went to school, we were only seeing one patient at a time and not juggling more than one. So I had to teach myself how to start seeing more than one patient, and having an office with a few more rooms actually allowed me to do that. I did that for about 4 years, and then I felt that I needed to expand again and took another risk. It's always scary to get out of the comfort zone when things are starting to go okay, but in order to grow, you have to take those risks. So I took that risk. I went to another office that had more rooms. And again, I had to learn how to juggle more patients. And I feel like personally, I got complacent. I was there for 10 years and I thought everything was going great. and I was kind of like finally comfortable with my practice, but something kept pushing me that it was time to grow more. And I kind of took that risk, and there was an opportunity for me to be able to buy an office building, which is why I call myself that's why I call myself Natural Approach Wellness Center at this point, because I'm blessed with the opportunity to get a building, which is much bigger. I have a backyard space, I have more rooms. So I'm able to, now I've incorporated exercise classes. We do yoga, we do fitness classes like body sculpting. I have a center where I actually have more room for herbs too. I just got a kitchen permit last year. So now we can do cold pressed juices and some healthy meals. And my goal has always been to continue to expand, and having this opportunity has really allowed me to have a wellness center where I can help a lot of patients in one facility and be able to provide so many different services. So it took me a long time. It definitely didn't come overnight. I've been practicing for a long time. It was about probably 7 years that I was able to move into this office, which has allowed me to become a wellness center. When Dr. Tina and Donna invited me to do this webinar, I was nervous to do it, but at the same time, I was glad that I had the opportunity, because personally, it took me a long time to be where I'm at. And if I can help anybody kind of shorten that duration or help you through something that may have taken me so long because I didn't have the guidance, I didn't feel like I knew enough, or I didn't have anyone to help me get to where I'm at, I will feel very purposeful, or I will feel happy that if I can help one person make this journey a lot quicker. And so again, I took on the opportunity to teach this webinar for that reason, to be able to help other people do it faster, because I think all of our goals are to help patients, help them naturally. And if we can continue to do that in a bigger scale, I think it's going to make a big difference. So I'm glad that I'm able to do this. If you guys ever need to reach me, this is my this is my website, mynaturalapproach.com. And like I said, I am in Melbourne, Florida at this point. So let's go ahead and start. I'm going to go over the 20 formulas like I mentioned before. And again, I'm going to keep it very simple. I'm a pretty simple person. And actually, you know what? I forgot. I also, when I was given this opportunity, I asked myself several questions, like what took me this long to actually start incorporating herbs, and what slowed me down from actually growing my practice, and what were the things that I had to do in order to expand, and what were the steps that I took. And if it's okay, I'd like to go over that with you guys, because without that, I don't think I'll be where I am right now. And again, I wasn't told what I needed to do in order to grow. So again, if I can help you guys, even one of you guys, just to make it quicker of a process, then I like to do that. So I knew that something had to shift in me somewhere along my practice in order to make my practice grow. So let's go over those now. So before starting an herbal pharmacy, and again, I didn't start herbs for a long time in my practice. I think before you start, definitely you have to educate yourself to have the confidence to recommend them. I'm not sure about you guys, but when I went to school, I was very young. I was 19 or 20. I had the memory, like perfect memory, right? I had perfect memory. I learned all my herbs. I memorized them so well. I took my test and I got straight A's. I got straight A's all the time, but asked me those herbs a few weeks later and I couldn't remember them all. I couldn't remember all their uses. What was the ingredients? I just couldn't, but I was getting straight A's at school. So I really feel that although I learned at school and I got straight A's, when I was in practice, I couldn't remember them. And I knew that I had to continue to learn. Most of the herbs obviously are in Chinese names. I'm not Asian, I'm Cuban to top it off. I couldn't remember all those herbs. It was so difficult for me to remember them after the fact. So I realized that I had to study, because I didn't have the confidence to even recommend them to my patients or to even know which herbs to give my patients. In school, it kind of seemed simple somehow, But then in practice, I started to realize that patients were complicated. And I was confusing myself because I didn't know which was the right herb to give them based on so many different issues that they were having. So I got super discouraged, and I barely used any herbs for the first probably 10 years of my practice because I didn't feel the confidence to even recommend them. So I think that was one of my initial shifts. I had to start educating myself again. But again, I'm very simple, and I like to keep things simple. Otherwise, if it gets complicated for me, I can't commit to them. And I know a lot of patients are the same way. If you complicate it for them, they're not going to learn either. They're not going to learn what the use of that herb is for them, and they're not going to comply. And from day one, I remember learning about eLotus and evergreen. And that was where I started. I started with eLotus because they had some courses like this, right? They have so many free ones. I mean, you could sign up for them. You could do all kinds of stuff. And based on your availability and time, you could take as many as you want. And you have to learn from people who've done it before. And you have to learn from masters. And you have to learn from people who are more knowledgeable than you and that can possibly simplify it. So I took a lot of courses or online courses too. And having that collection formula that they have to me was the best because they had English names, right? Again, English names, I speak English. It made it so simple for me, at least simpler. So, these herbs especially with evergreen, and again, I'm not getting paid to say this. I'm saying it because I truly, honestly believe that this is great. Two great companies, eLotus to educate us, and the herbs. The herbs are easy to swallow. Patients can complain about that. They dissolve very easy. They're clean products. I mean, they go to some crazy inspections to make sure that the products that we do get are herbs that work. Because if you get herbs that don't work and you give them to your patient and it doesn't help them, you're going to have another issue there because now your patient's not improving and they're not going to have trust in you that you know what you're doing. So having a company like this, Evergreen, that actually has amazing herbs that actually work because they go through so many inspections is a plus, right? What else? The simplicity of having this book too that comes with the herbs is amazing. That's my book right there. It looks a little beat up, but I use it all the time. That book tells you everything that you want to know about each formula in the English, in the Western perspective. It tells it to you in the Eastern perspective, so you learn too. And it kind of breaks down the herbs, so you learn a little bit more about the herbs if you have more time. There's even a section in there that tells you about nutritional changes that you can do for the patient. And you can educate the patient by telling them more, because it's not just up to you giving them herbs. It's actually up to them to do their part. So when they leave, they have to be eating the right things or avoiding the things that are actually triggering their condition. So educate yourself as much as you can. Have the confidence, because your confidence is going to show and the patients are going to follow your recommendations. So again, learn as much as possible before you start incorporating a lot of herbs into your practice, because I feel like that was my first shift. And if you prefer the Chinese formulas and that's something that you're more attuned to, these two books, also these are my books, I have little notes everywhere. These are great. These are also from Dr. Tina and Dr. John Chen, and one is on single formulas and one is on single herbs and one is on formulas. And I love it because if you don't know how to treat something, I mean, you just look up the condition that the patient is complaining of or what their issues are. It kind of gives you some guidance, and it's going to help you so much. And you can study this on your own whenever you have time. So here, the first seminar that I took, I would say that really started to shift me into learning more about herbs and kind of get me more interested in really educating myself more was the seminar with Dr. Jimmy Chang, the one all the way to the left. I actually took a seminar from him on eLotus about pulse diagnosis in herbs. Again, pulse diagnosis for me was a weakness after school. I remember I had like 10 people taking herbs and we all had a different diagnosis when it came to pulse diagnosis. And I was so confused in practice too, because I was like, I didn't feel confident enough either. So make sure that whatever weakness you have as far as a practitioner or herbalist, make sure you take courses, again, to make you better at it. So I took a course online on eLotus with Dr. Jimmy Chang, and I loved it. I loved it because there was a simplicity, but such a depth to the way that he teaches pulse that I felt like that was going to help me in practice. If I wanted to grow my practice, I had to grow my own knowledge. After that, I figured out where he was going to be teaching, and I flew to California and I took that course with him there and Dr. Tina. And it was really amazing, all the stuff that I learned just from that seminar. So again, I encourage you, see where you're weak at and try to take some seminars to help you. And then I was left with this need to learn more after I saw him taking pulses. And he was so amazing at taking people's pulses without them even telling them what was wrong with them. He was taking the pulses, he knew what was wrong with them, and he would give them a great formula. And the formulas made sense to me. There's so much knowledge that he has, but at the same time, there's a simplicity that worked for me too. And then I was intrigued. I wanted to learn more. So I was able to, figure out that he actually does have interns. I'm not sure if he still does that, but I was able to take the time and budget and to go see him. So there's my picture with him. The first time I went to his clinic, and I spent 3 days with him. And again, he's a brilliant man, and I learned so much from him in those visits. And then I spent 5 years or so probably practicing some of the stuff that I learned from him so I could get better, because it's not something that comes overnight, but it comes with practice and experience and repetition. And then I wanted to go back again because I wanted to learn more after I practiced what I had learned from him. So then I went back. That's the last picture with him there. And again, if I can encourage you to keep learning, and eLotus is such a great place to start your learning. This is Dr. Bob Doan. I also took a course from him on eLotus. He does pulse diagnosis too, and he also does distal acupuncture. And again, I was blown away after I took his course here on eLotus. And I called him up and figured out that he actually does internship too. So I went and I spent 4 days with him and his wife in Paulsville, Washington. And I have learned so much since because of these two practitioners that know so much. And I could tell you that once you learn from someone like this, or from anybody that knows more in an area that you are lacking, your practice is just going to grow so much because of the confidence that you're going to have that you can help patients. So let me encourage you again, study as much as you can, learn, take more classes, and then you'll be a better practitioner and you'll feel better about incorporating herbs. Something else that I had to overcome was feeling like I was a salesperson. At school, they teach you how to be a doctor, but then in practice, you almost have to become a salesperson because you have to recommend products and you got to sell them things. And I was always pretty timid and shy. And when I started to talk about herbs, I felt like I was selling them. And I didn't like that. I didn't like that feeling of feeling like I was selling, right? I mean, there is profit to be made, but that wasn't the reason why I was recommending the herbs. And I think if the patients can tell that you feel like you're selling them, they almost get turned off by that, because they realize that you're trying to sell them. But somehow I had to shift that, right? I had to shift that thinking because I wasn't selling them. I was actually helping them, right? I was creating a solution to their problem, right? They were having an issue that I could help them with, and that was an herb. So somehow I had to shift that. I wasn't selling. And in the minute that clicked in my mind that I wasn't actually selling, even though there is a profit for me, I was actually helping them. And once I changed that train of thought that I'm helping them and I'm providing them with a solution to a problem that they have, again, I grew in so much confidence in my practice, and my patients have done better because I realized that I'm actually helping them. Giving someone herbs is great because when they're not coming to you for acupuncture, you're actually helping them still because they're taking the herbs. So while they're not with you, they're continuing to make progress in the right direction, which is taking the herbs. The herbs continue that, breaking up unblocking the pathways and kind of helping their bodies heal themselves in the meantime. So you always have to encourage patients that, hey, while you're not here getting acupuncture, if you take these herbs, you're going to continue on that path to heal. So I had to change my mindset that it's helpful for them. Sometimes you'll see patients that they could only afford one thing or the other. If they can't afford acupuncture, then herbs are the next best solution. Again, you're not selling them, you're telling them this is what's going to help you with your condition. But let's say they go on a cruise ship or they go on a trip, then the herbs are the best because they can still get some care while they're away. Or if their schedules at work they don't work with your schedule, then giving them herbs, it's going to be great because they're still getting some kind of natural care to help them with their main symptom. So let's change our shift from thinking that we're selling, to we're actually helping them, and we're actually providing an opportunity for them to have a solution. Now, these are things that at school I didn't learn, right? I didn't learn how to have a business, how to be a marketer, or how to actually sell my services to my patients. So again, I'm sharing this with you because I feel that before you start an herbal pharmacy to be successful, if you learn these things, you're going to eliminate some of the failures and other things that I went to. So that's why I'm sharing them with you. The next last thing that I want to cover before we go with the 20 herbs that you guys all signed up to listen to is start with purchasing a very small quantity of formula to ensure you do use them. When I started my practice and I started to study a little bit here and there, I started to buy herbs because I was like, wow, that one sounds like a great herb and that one's going to be a great herb. But then it will be 2 years before I saw a patient who needed that herb. And I was just throwing herbs out here and there because they weren't practical herbs. They were herbs that sounded beautiful on paper and it sounded great, but then I didn't see a patient with that condition at all. And it got to the point where I was trying to take the herbs myself because I didn't want them to expire, but I couldn't take all the herbs. I didn't need all those herbs. So don't waste your money. Don't buy a bunch of herbs that you don't need. Again, the ones that I'm going to go over are definitely herbs that you will use before they expire. You will usually have a patient, I almost guarantee it, that will use this herb. So start with a small quantity, especially if you're on a budget or you have limited space. That would be the best way to start. So learn from me. Don't buy a whole bunch. Don't try to take them yourself before they expire. All right, so let's start. Does anybody have any questions? No questions. Okay. So again, I'm going to go over these 20 herbs and I'm going to keep it very simple. I love these herbs because they're part of the collection formula and they have English names. That makes it so simple to remember, to even have on hand, because every patient with this condition should do really well with these herbs. So the first one here is for musculoskeletal system, and this is for any type of acute back and hip pain. So anybody who comes in that has acute back pains, anywhere in the back, lower back, the hip. Let's see, let me put myself here. I'm covering my PowerPoint. Let's see. Or if they've had chronic back pain and then their back pain starts to hurt really bad again. So this is the formula for them. It's called Back Support Acute. I use this formula when a patient presents with just back pain. Sometimes it's mid back, sometimes it's low back, but that pain doesn't go anywhere else. It just stays in that location. So if it starts to radiate to any other area, then this is not the formula that I like to use. So again, maybe they sneezed and they hurt their back, they coughed, they hurt their back, they twisted, they slept wrong. Anything that can create this pain in the low back, or again, mid back, this is a great formula. And if you revert back to that book that I was talking about, this clinical manual, that book tells you also how to use it as far as the dosage, because if they're in a lot of pain, you could actually increase the dosage and to give them some pain relief quicker, so they don't have to wait so long. Because sometimes the recommended dosage of 3 or 4, 3 times a day is not enough when they're in so much pain. So get the book. They actually have an online version too of that book, so you can look up exactly how to give it to them. so they know how to dose it throughout the day so it could help them. This is another one for musculoskeletal system, and this is for herniated disc. Sometimes the patient knows they have a herniated disc. Sometimes they don't know they have a herniated disc. You know, they may have had an MRI or anything that confirms it, but if they have not had an MRI, but they're coming to you because they have back pain that actually goes down to the extremities, this is the one to use. It's called Back Support HD. Sometimes it doesn't go all the way down the leg. Sometimes it goes down just to their glutes. Sometimes I've seen it just radiate to the front of their body, to their groin, and maybe only one leg. Sometimes it's actually both legs. Sometimes it goes down to the feet. This is regardless of whether or not they say they have a herniated disc, this is the formula that I like to use. So again, the other one was just when their back pain is localized or centralized in their mid back and low back. But the minute that pain starts going down to an extremity or to their glutes or their groin, this is the one that I like to use. And also, again, there's a specific way of taking it, you know, more during the day or every 4 to 6 hours, so you actually get some relief from this. This one's musculoskeletal system as well, and this for acute neck and shoulder pain. It could be for pain, it could be stiffness, it could be limited range of motion, anything of the sort. This one's called neck and shoulder acute. Again, these names make it so simple because they really work and they help so much. I mean, the patient may just come with shoulder pain, this one's gonna help. Sometimes they come with just neck pain and this one's gonna help. But sometimes the pain does go down from the neck to the shoulder. So again, this is such a great formula. I have so many patients, you know, who they sit on the desk all day or they step the wrong way, they can't turn their necks. I mean, old injuries, whiplash, anything of the sort. This is such a great formula. I like to combine this formula with Back Support HD when I find that their pain actually goes down the extremities. Sometimes their pain doesn't just stay in the neck, it actually starts to go down their hand, or they feel tingling in their hand or numbness or any type of issues with their hand. This is a good combination of neck and shoulder acute and the Back Support HD. So here you start to see that these formulas can be combined and it makes it easier too. Again, they have English names. You can't get confused on what they're for. It's just getting clever on how to use them together. Let's see. This one also for the musculoskeletal system, and this is for when someone has knee pain. So it could be issues with anything ACL, PCL, MCL, LCL, or kneecap, the meniscus. It could be anywhere in the knee, any type of knee pain, knee injuries. This is excellent, knee and ankle acute. And you'll see the next slide, if you have ankle injuries, this is also the same formula. So it's great because it actually works on both. I have so many patients who are runners, where they actually fall, or they hit them, you know, hurt themselves. Even if there's a small little tear or any type of issue, I've seen that these herbs work almost miraculously. It really helps them heal. You know, sometimes they injure themselves, but they have to go to the doctors. And it might take some time before they can even get an MRI or even get to their doctor. And in the meantime, they're suffering and pain. So this herb is perfect because in the process of them getting an MRI or anything of the sort, this is still going to give them relief. I've seen, again, such miraculous results when people have injuries like the knee. It really helps them heal so much quicker. Next one is another one for musculoskeletal, is for acute neck and shoulder pain. I went back. Let's see, this one for ankle pain. So this is the same formula, knee and ankle pain. And this is also for acute injuries. There are other formulas that are for chronic pain. I don't use the chronic formulas that much in my office. I kind of started some a little bit, and you can use them, but I feel to keep it to my top 20 that you will absolutely use the most, I think the acute formulas are better, because the patients are not going to come to you with chronic pain. They're going to come to you when they are actually in pain and they need some relief right now. So the acute formulas work that fast. So this one's if they have ankle pain. And again, knee or ankle, same formula, works amazing. You know, and if you're like me, I actually have patients who have knee and ankle pain. So this formula is great because I don't have to give them another one. This one actually addresses both issues really well. And this one, like all the other formulas for pain, you can actually increase the dosage too, based on their pain level. So if they're having a lot of pain, you're gonna have to give them a little bit more throughout the day until they get out of that incredible pain that they came in. See? I keep going back. Okay. This one's for generalized pain. So sometimes the patient comes in and they have pain everywhere, and you know, almost like a fibromyalgia, or they just ache all over. They're tired and they're aching everywhere, and they can't tell you exactly where they're hurting. This is a great one because sometimes they don't want to take Tylenol and they don't want to take ibuprofen. They don't want to take things that actually cover their symptom. They actually want to address the problem. So this one, herbal analgesic, is excellent for any pain. It does not have to be in a specific area. Again, it's a great alternative to over-the-counter pain pills or prescription drugs if they don't want to go that route and they want to do something more natural. So herbal analgesic. I like to combine this with other pain formulas to increase their effectiveness. So if someone's coming in for neck pain and maybe perhaps just the neck and shoulder are acute, it's not enough, but they're not getting the results that I want to see, I usually try to combine it with this just to kind of give them a little bit more, to give them more relief. I think I learned this from Dr. Chen in one of the courses that I took on eLotus. I believe that it was he who said that if you could get the patient to take the herbs like 30 minutes before you give them acupuncture, the results are so much better. And I've actually done that enough when I've had a few opportunities to be able to do that. And it does make a big difference because the herb is already in their system. And then once you do the acupuncture, the results are much quicker as well. So, but this wouldn't be for a new patient, right? If a new patient comes in a lot of pain, you know, I think sometimes the trust of even taking an herb on the first visit, they might not want to do that right away. They would just want acupuncture. But if they're already your existing patient and they trust you, and maybe they already have the herb at home, they could just start taking the herb and then they come in and they get their acupuncture. But it's a matter of educating your patients, right? So if these are the patients that you already know and they already know you, you could just tell them, you know, or they can come take the herb and then wait about 30 minutes and then you give them acupuncture. And again, this is some really nice information that I learned from one of the webinars that I took here from eLotus. And again, if you get these little tiny nuggets from these other practitioners that are trying to help us all improve our practice, I think it's going to make a big difference in your own practice. So again, combine this with any other formula that has pain to make it better. But again, if they just have pain all over, just use this one. I mean, if we can help eliminate the use of ibuprofen or Tylenol or anything that's a little bit more harsh on their system, this is a good alternative to go. So I'm not sure when I'm supposed to answer questions, but maybe I'll answer a question now. It says, I want to find out if we can increase the dosage more than that is prescribed in the bottle of the formula. Is that an upper limit of our dosage generally? So yeah, like I mentioned, if you guys look at this book, it actually, for the pain formulas, it actually tells you how to increase the dosage when they have pain. For example, the minimum dosage is always, 3 to 4, 3 times a day. But if you have pain, you can probably actually take 5 or 7 every 4 hours, every 6 hours, depending on the pain. But refer to the book because the book is actually very specific and you can actually increase the dosage for that. And it makes you feel better knowing that it has been done before and it does work and without much harm, without any harm. Just because they have so much pain, you actually have to do more. And somebody asked, what will be the formula for chronic back pain? That is back support. There's actually a chronic one. So not the acute, there's a chronic. And again, if you get that book, it gives you, options too. Okay, so I'm getting lots of questions. I might have to hold on to the questions till after, but I will respond to them because these are really good questions. Okay, and I'll need the time. I'll fill up the time that I maybe don't have or that I have left over with those questions. So thanks for asking them. I will definitely address them. Okay, so again, this one for any type of generalized pain. Let's see, next one. Okay, this is a good formula for women with either PMS, stress, liver qi stagnation. So the indication is that PMS, stress, general liver qi stagnation. So the formula is called CALM. And if you guys are more familiar with Chinese names, then this is very close alternative to the Jiaowei Shaoyasan. It has 2 extra herbs. And I think that makes it somehow a little bit better, in my opinion. So this doesn't have to be, just for women. I found men who are very stressed out, obviously have liver qi stagnation. It's a great formula. It really helps to calm them. Also, when their nervousness is affecting their stomach, causing some kind of like liver over stomach or liver over spleen, this is such a great formula for them. And it doesn't necessarily because sometimes patients are like, oh, is it going to make me calm? Is it going to make me sleepy? Because they read the name. I'm like, no, not necessarily. It's just going to help you be more balanced, and it's going to help you in general be less stressed. And specifically, also women with PMS, it's going to help them not be so irritable or stressed out. This is under the category of stress, physiological and sleep disorders and anxiety, irritability and insomnia. So there's 2 formulas here that I really like. Let's see, called Calm ES and Calm CCZ. So Calm ES, so it's similar to the other one called Calm, right? So this one's ES because it's almost like extra strength, and it's for that liver qi stagnation when it has heart fire for more severe cases. But to keep it simple, it really is just a severe anxiety. People who have panic attacks, severe emotional distress, or, prior to their period, they have like serious PMS. This is really, really great. The CALM-ES, I always use this patient, again, for those who have severe anxiety and who have panic attacks. I've learned that over the years that even if I tell them just to have it handy, and if they just take 4 capsules when they start to feel that anxiety, it actually works really fast. I mean, I tell my patients, take it in your purse, take it in your bag. I don't care. Take a little Ziploc bag with them in it. And before you start to feel that severe anxiety or that panic attack, just take 4. And I have found that within 15, 30 minutes, even personally, it really makes a difference and actually calms you down. So it can alleviate a lot of unnecessary stress and panic attacks because it actually works. To me, I think it works that quick. And my patients can agree too that it works that fast. So they don't have to take it all day with this formula. Most formulas you have to take all day to help, but this can help if you take it all day. Obviously, if you have an ongoing issue, an ongoing anxiety or panic, and you feel irritable or restless all day long, then yes, you can take it all day. But again, it's one of those that I found that actually works really well, just that small dosage, because it works almost instantly. The next one under this collection is called Calm CCZ. This one's really good for liver qi stagnation with liver blood deficiency, when they're really more stressed out in a sense. This is another one that I have found that works really well without having to take the full dose. My patients who I find that are like that type A and they're very stressed and have so much work-related issues going on, or their mind just doesn't stop. And you find that they're waking up between the liver time and they're waking up between 1 and 3 a.m. This is such a great formula. Calm CZZ it's just amazing. I give it to them. I suggest that they take it 4 at bedtime. And if they wake up again between 1, 2, 3 in the morning, I have them take it again. And it really works that well. I mean, I think I've only had a couple patients who didn't respond to it, but that's very rare. Perhaps they have other underlying issues that, I wasn't addressing. But I would say the large majority of the patients that I give Calm CZZ at nighttime work really, really well. And most patients are under so much stress and they can't sleep and they have so much insomnia and so many issues waking up in the middle of the night. Sometimes they think it's their bladder and they think it's something else. Well, it's probably not. They're just stressed. They wake up and then they think that they have to go to the bathroom. So if you can help them sleep through the night, it's going to alleviate so many issues because they can be more rested. They're not going to have so much tiredness, and they're going to feel better emotionally too because they actually slept through the night. So something really important to address with our patients is sleeping through the night. So Calm CZZ, if they're waking up between 1 and 3 in the morning, such a great formula, and only taking 4 at night seems to work for most of my patients. Another formula for women who are having period-related issues, dysmenorrhea, any type of GYN issue, endometriosis. This one's called Men's Ease. Something that I've found in practice is that most patients think that issues with their period are normal. And no, they're not normal, they're common. And we have to stop that issue because we shouldn't suffer every month with this. And our patients shouldn't either. And once you educate them that it's not normal, that it's only common, then you can actually get rid of their pain. Again, they earn so much trust in you because they've been having this issue for so long. This herb called Men's Ease is really great because it helps with that cramping, pain, any type of issues with your period. So I suggest always having this formula for my patients on hand. So if they know when they're going to get their period, I always have them start it a few days prior. So maybe 3 days before something. Sometimes they do already start the cramping. So yeah, go ahead and start it. But sometimes they haven't started the cramping yet. And if I have them take it beforehand, it makes their period so much better. So if they already tell you that they are known for cramping or issues with their period, make sure you recommend this product because they want to have it on hand. Otherwise, if they don't have it on hand, then they're going to go through that process of having pain unnecessarily. So I always have patients take it a few days before, and then I have them continue to take it while they have their period until the cramping goes away. It works really, really well. If patients don't know when they're going to get their period, I always suggest to have my female patients have an app called the Female Tracker because they can start inputting when they get their period and when it ends, and then it starts to give them like an average. So then they have an idea when their next period is. It's also a good tool for you guys because it starts to show if their periods are early or late, or if there are any issues because it starts to show some kind of imbalances with their period, and it's good for them too because most women think that they know when they're getting their period or based on a day, but that may change on a monthly basis. So it's better to have a tracker for their sake and your sake so you can help them better. But this herb, another one you should have on hand. So making sure that they have it at home so they can actually get some relief with their period pain. Works really, really well. Menopause, another symptom that we have been led to believe that is common, that is normal, is menopause. Not normal, not supposed to be having hot flashes because it's just an imbalance, right? So if we can educate them that they don't have to suffer through menopause, and if we can balance them out, then they will feel so much better. So it's called Balance Heat. Nourish is another one that we use too. For the sake of this presentation, and I wanted to keep it to 20, I'm just going to go on Balance Heat. If you like Chinese formulas and you're good at those, then it's a similar one to the Qinghao PH Yatang. Excuse my reading. Not very good at reading them. And it also, Balance Heat also has a few more herbs. So I believe that the collection formulas have perfected some of these Chinese formulas and made them better, maybe to address what's going on with our patients today. And this one, I have found that has worked on every single patient I have ever suggested it. I have found that within just a month of taking it, their hot symptoms, their hot flashes are gone. And what I like about it is that you're not actually giving them a hormone, you're actually balancing their body, so their body actually addresses the hormone imbalance. And that's so much better than having to give them hormones. So that a lot of patients prefer that, because everybody's scared of taking hormones. They're concerned with estrogen and all the issues with estrogen dominance. So giving them something like this that is safe and natural and seeing results is really impressive. I just had a patient 2 weeks ago tell me that she literally took it 3 days and she hasn't had any symptoms yet. And she stopped taking it. I was like, no, keep taking it. But she stopped taking it after 3 days because she's like, they're gone. I don't have them anymore. So some patients respond very quickly. I mean, the other ones tell me within a week or two, they just haven't had it for months. So I think it's safer for them to take it at least for a month. But if after 2-3 weeks, even just a week or two, they're feeling much better, then this actually works really drastically. So a great one for general menopause symptoms. This one's for damp heat in the lower jaw. So any type of genital urinary disorders. So you can treat it for any of these issues: vaginitis, PID, general urinary infections, itching, yellow discharge. My picture is over that, so I can't read it. Oh, eczema, UTIs, STDs, inflammation of the lower jaw. So these two formulas I also use a lot in my practice. So V-Support and Gentiana Complex. V-Support is the one that I like to use for UTIs, and it works so well, and it works really fast too, especially if the patient can start taking it right away in combination with other formulas. Like we're going to go over another herbal antibiotic in a little bit. I love to combine this one, V-Support, with herbal ABX for any type of UTI infections or cystitis or anything of the sort. I mean, the symptoms are pain on urination, they feel very bloated, and they feel like they have to go to the bathroom. And when they go, they just urinate 1 or 2 drops, and it's extremely painful. And it's because they have an infection. So V-Support works really, really good for that. Again, if this is another formula that if a patient is prone to having UTIs or urinary tract infections, I always like them to have some on hand, because sometimes it happens in the middle of the night. They wake up and they already know they have an infection. So if they have that at hand, they can start taking it right away. So yeah, I wrote it on. Okay, I use it mostly for UTIs and along with herbal ABX. If the UTI is from intimacy, then I always recommend taking it prior and after. And that really minimizes the infections. So if they disclose that with you and they're open about having UTIs from intimacy, then you have to suggest that they take this at home, take this formula at home. I mean, take it, have it on hand. So before intimacy, maybe they could take 4, and then after the fact, they could drink more water and take 4, and then we really minimize that occurrence of having UTIs. I've had a lot of patients use this method, and it works really well. So again, it's like educating your patients, giving them the tools, and then they trust you, and they're going to do better because you're helping them kind of be in charge also of their health, and they feel like they're actually part of the solution. So Gentiana Complex that one's really, it's the same as Gentiana Complex is like Long Dan Shiga Tang, and it treats high blood pressure too. And Gentiana Complex is more for high blood pressure that is in excess. And the way that I know is excess is if you take their pulse, right? You take their pulse, and that's something that I had to learn too, because I wasn't, like I said, I wasn't very strong in pulse. So I took pulse diagnosis from Dr. Jimmy Chang and Dr. Bob Doan. And even the simplicity of knowing when it's in excess or is deficient, you'll know which herb to use for blood pressure. So Gentiana Complex is the one that I will use if it's in excess. If their blood pressure is really high, their pulses are really strong, this is a good one to use. And if they have STDs or genital herpes, this is one they could use topically as well. I always tell patients just to put in open them up. If you only have them in capsules, open them up in water. They can wash with it. They can apply it to the area just like a wash, and it can help. It can help locally as well. This is for immune deficiency and energy disorders. So this is when they have weak immune systems, frequent lingering infections that's hard to heal, and HIV or AIDS. I personally have never had a patient who wants me to help him with HIV or AIDS. I have had them, but I've never had to address them. But Immune Plus is a great formula to help just boost the immune system. And what I like about this one too is that you don't have to do too much of the herb to get results. And again, if you look in that book, this book, it tells you got to take like 2 twice a day when you combine it with other formulas, and it works really well. You don't have to take so many capsules a day to see the results. So I like this formula for those who have seasonal allergies. I'm not sure where you guys are all located, but I'm in Florida and we have so much pollen. Like all our cars have this thick layer of yellow stuff all over them. So the allergies for us is really a problem. And Immune Plus with Magnolia Clear Sinus, which is not on this presentation, is a great one to combine to help with any type of stuffiness, sinus issues, and to prevent infections too. Because obviously if you could get this cleared up and boost your immune system, then the infections are going to be less. So I have them take it before the season starts. They always know when they're going to start their allergy seasons, depending on where you guys live. And they already know from history when they're going to start having issues. So if they know in March, like here, always by March, we have terrible allergies. I could have them start taking it like in February or something, even a couple of weeks before, to start boosting their immune system so their allergies are less. Because we're all exposed to the same environment when we're outside, but not everybody has allergies, right? I don't suffer from allergies, so, and all my patients do. So it just depends. If your immune system is strong, then you're going to be able to deal with it and your body deals with it. But if they need help, this product, Immune Plus, is such a great product to boost their immune system and get them prepared so they don't have these terrible allergies. Okay. This one's for energy, and it's like a comprehensive tonic for chronic fatigue syndrome and just enhancement for recovery and long-term anti-aging tonic. It's called Imperial Tonic. This is for patients who are weak all over, right? They have the chronic fatigue syndrome. You take their pulses, they're super weak, they're barely there. Maybe their tongue is pale. They're just so depleted. Imperial Tonic is such a great formula. I've also found that moms, ladies who have had babies, they're so depleted, they never take care of themselves. And then they start running on low. Maybe they have postpartum, and it's usually because they're so depleted after having a baby. This is a great one to help them after the fact. And if they're breastfeeding, I believe you have to wait probably about 6 months to give them an herb because the baby can digest it, but you have to ask the experts like Dr. Tina, Dr. Chen to make sure. But if they're not breastfeeding, definitely give them Imperial Tonic right away to help them heal from the depletion that they went through when they had the baby. But any type of chronic fatigue, any type of fatigue that they're having, such a great formula. Let's see. This one's for respiratory. Oh, I did go over Magnolia Clear Sinus. Okay. This is the one that I like to combine with Immune Plus. This is for allergies, sinus issues that have clear and white nasal discharge. Obviously, it's not an infection. If they have an infection, it wouldn't be this formula. It would be a different formula. But if they just have that common allergy, stuffy, clear nose, they can't breathe, their eyes are watery, this is the right formula. So again, I like to combine it with Immune Plus for even better results. Together, they work great, and they can start taking them both before allergy seasons as well. This one's for a detox or cleansing formula, toxic heat, and generalized bacterial infection. This is the one that I was talking about, herbal ABX. I like to combine this with the other formulas when they're having some form of infection. Like the patient that I was mentioning, if they have a UTI or urinary tract infection, I always like to combine it with herbal ABX. I just personally have found that it works better with my patients having both of them together. If they're having like a herpes outbreak, I combine it with the Gentiana complex as well. If they have, instead of regular allergies, if they actually have a ear, nose, and throat infection, I love to combine these two together, herbal ABX and herbal ENT. Great combination. And it's suggested for them to take the herbal ABX because it's like a natural form of an antibiotic, to take at least 5 to 7 days to make sure that the infection has gone away. I always tell patients, take it 5 to 7 days and then see if you're all better, then you can discontinue. But if not, you probably want to take it a little bit longer. But I don't have them stop beforehand. And that this book that I keep mentioning, it also tells you, like if they have an infection and, they have a ear, nose, or throat infection, when you go to herbal ENT, it has other formulas that you can combine depending on their symptoms too. So it makes it very useful, and it really helps to educate you and gives you the confidence to recommend these formulas to your patient. And again, if you get results, they're going to trust you. They're going to continue to ask you, because now at this point, patients will come to me before they go to their primary doctor and they tell me that they have something going on. And most of the time the herb will take care of it. And then if it doesn't take care of it, then of course they could go to the primary and get, something stronger or an antibiotic. But once you educate them and they trust you, they're willing to try the herbs too, in combination or even firsthand, and you're able to help them naturally so much better. Let's see. Okay, so this one's for stomach issues like IBS, diverticulitis, colitis, nervous bowel. It's called GI Harmony. We have several stomach formulas. The most trickiest patients for me sometimes is when they complain of bloating. After I've changed their diet and I've eliminated all the cold and raw food and they still feel bloated, they've eliminated dairy, drinking with their meals, and they still feel bloated. I feel like this is such a great one, GI Harmony. That's just my personal takeaway from my patients, because I had a hard time with the bloating patients. I couldn't help them too much until I started to use this formula. And maybe you guys are having the same issues, but if you're not, then good for you. But this is a good one for bloating. But again, IBS, diverticulitis, colitis, and nervous bowel. This one will help it too. This is when they have poor appetite, indigestion, or loose stools, like spleen Qi deficiency. I like to use GI tonic. Some of these are simple when it comes to their explanation. I haven't found anything specifically clever to teach you about this one, but spleen Qi deficiency. You can tell by their tongue, by their pulses, their symptoms. Again, this is going to help strengthen their stomach. And again, in that book, if you read the book, it gives you a lot of nutrition advice. So you got to help the patient, because their herb alone is not going to help, right? So you have to tell them to read that section, or you make a copy for them that tells them what kind of diet changes they have to make so they don't have spleen Qi deficiency, or they don't continue to add to this problem. Because they have to do their part too, and it's our job to educate them. So if we educate them, they're going to heal faster, and then they're going to do better, and you become a better practitioner because now you have educated them on what they can do instead of them only relying on us to get better. Now they're part of the solution, because they have to be part of the solution. Otherwise, they're not going to get better. So make sure that you read that book. Make sure you read the nutritional recommendations, and your patients will do so much better. Okay, so GI tonic is for that one. If they're having any type of gastrointestinal issues or GB issues, such as constipation too, this is what I like to use. So mainly for constipation, acute or chronic constipation. They have two formulas called Gentle Lax for excess and Gentle Lax deficient. So how do you decide which one to give them? I base it on their pulse and diagnosis. Also, you'll know if they're in excess, use the excess one. If they're very depleted and you feel like that's why they're not moving their bowels, then give them the gentle lax deficient. It works really well based on their diagnosis. So I usually, again, this is not one that I use long-term. I usually suggest that they take 4 capsules 3 times a day until the desired effect. So once they move their bowels and they feel like they actually went well and they evacuated properly, then I tell them to stop taking it. I don't feel like at that point they need to keep taking it. And if they get constipated again, or maybe they go one day without moving their bowels and they know they're going to be constipated, then I tell them to start again. You might want to take it for, 2 to 4 weeks. It's not going to hurt them. Again, it's just something that I've noticed with my patients, that if they just take it as needed, it works really well too. But if they've had chronic constipation for many years and it's a stubborn type, then they might have to take it for longer. But a simple, just 4 capsules 3 times a day actually works well. There's no need to increase the dosage on this one, at least not in my practice. Okay, this one is for depression. This one works really, really well too. If the patient has depression, and I feel like if they have like a damp pulse, it really works well for them. Just keep in mind that this formula has St. John's wort. So it has Guan Ye Yin Sitao. Again, please forgive me. I'm not very good at reading them. So make sure your patients can take this ingredient. Sometimes they cannot, and it cannot be combined with antidepressants. So make sure you take a good intake and ask them, because you don't want them to have an interaction. But if they're not taking antidepressants already, or they can take St. John's wort, because they'll know, you could ask them to, then this one works really well. But again, read that manual. The manual goes into more depth explanation of why they can't take it if they're taking an antidepressant that makes it contraindicated to take St. John's wort. Yeah, I got lots of questions. I'm going to take just a few minutes to answer them. So can you recommend a formula for peripheral neuropathy after chemotherapy? So there is a collection formula called Flex NP, which is neuropathy. I have found that works. Chemotherapy, neuropathy may be a little bit more tricky. That may take more time. I don't have experience of long-term to see how it has helped them, but there's always relief. I've always seen some kind of relief. I don't know if it goes away. Sometimes patients don't stay for a long time, especially with that kind of condition. So it's hard to tell. But if you do acupuncture and you're able to give Flex NP and do anything to kind of increase circulation to the extremities, at least you're giving them a chance, right? It's better than nothing, and increasing circulation to the extremities is gonna help them in the right direction. And with a combination of acupuncture, it should help too, for sure. The other question is, will generalized pain formula help with headache pain? I've seen patients that it works with it and some patients that don't. So I think you can try it and see, because it does replace, like, Tylenol, ibuprofen, any type of pain pills that they take anyways. If those seem to work for them, then this may help them too. But if they need prescription drugs to give them relief, then this may not be strong enough initially, but as you help them with the acupuncture, then this might be something that may help them. So it's definitely worth a try. Any caution if your patient is in their 90s for pain they have had for 7 or 10 years? The only caution that I find is that if they're on blood thinners, you got to be very careful. And I'm going to be talking about that soon too. Anybody on blood thinners. So if they're in their 90s, perhaps some of them are on blood thinners if they've had strokes or they've had any complication with cardiovascular disease. At that point, I usually do not use herbs because I don't want to create any issues or risk of more bleeding. And when they're in their 90s, you could always start. I have patients in their 90s. I just start herbs, almost like the lowest dosage, and see how their tummy handles it. Most of the time they do okay. Someone's asking if I can repeat the title of the book I'm referring to for the dosage and changes. Is this one. I'm sure you guys can see it. It's called Clinical Manual of Oriental Medicine. It's a book that talks about the evergreen herbs. And I'm not sure if you have to purchase it or it comes with your order. I don't remember. I've had this book for many, many years. And that one has all the collection formulas in them. And it has all the explanations. It is such a well laid out book. And again, I've had it for years, so I'm not sure, but I also have an online version of it. So I'm able to look it online too if I don't have the book next to me. Please discuss the formula of herbs used to treat different types of pain. So that one's just the herbal analgesic. That's just a generalized formula that evergreen carries for any type of pain. And you could take it by itself, or you can add to any other formulas you may be taking, such as neck support, the ones for your neck, for your back, for your knee, for your ankle. You can add the herbal analgesic to it. Okay, let's see. All right, I'm going to keep my presentation, make sure that I have enough time, and then I'll go back and answer these right before I'm done. Okay, so now we're going to go over those helpful tips that I had promised you guys initially that I have found that can help you in practice as well. Again, anything that I can do to help you in areas that I had to learn by myself or struggled with, and that I've seen that has helped me succeed and make me a better practitioner, I'd like to share that with you. So let's go, just a few of them. Here's some helpful tips. So in my practice, all these herbs that I'm recommending, I have them personally now in capsules, and I have them in powder. If the patient needs more than 2 formulas, I find that it's too many capsules, right? They don't want to take that many capsules. If I give them 3 formulas, they have to take 4 of each 3 times a day. They're taking 12 capsules 3 times a day. A lot of them may not want to do that. So I've learned to buy some in powder. So if they need 2 or 3 formulas, I just combine them and I give it to them that way. So it makes it a lot easier for them to consume. So depending on you, if you have the budget or if you have the room to carry both, it all depends. But if you have the option of getting them in powder and in capsules, then you can. Maybe you only like to do powder, so then you'll be okay with that. Powder, you're not going to run into the problem of them saying that they take too many pills. So I like the capsules. I like to carry both because if a patient only needs 1 herb, I'd rather just give it to them in capsules because it avoids them telling me it tastes yucky, right? It avoids that. So I just give it to them in capsules and then we're good. I don't have any issues with them complaining about the taste. But if it is more than 2 formulas, I always blend them because it's just too many capsules. And I explain to them why I do that. So again, if you could have capsules and powder, it's going to make it easier. Excuse me. So in my office, I have a capsule maker. I don't encapsulate the herbs for my patients, but if I actually have made them into a powder for them and I make them have a tea and they can't drink it, right? The herbs only work if they can drink it. If they're nauseated and they want to throw up or they can't even stand the smell, then you have to help them somehow. So what I found is that if I have capsules available at the office that I sell to them, then I just lend them my capsule maker. I'm not sure how you're in your practice, if you can lend out your capsule maker or not, but I've found that I have 2 capsule maker. My patients love that I can share with them so they don't have to buy one themselves. I have a list of who checked it out and then who brought it back. So we have a really good, honest system of checking it out and they bring it back within 24 hours so another patient can borrow it too. That makes it easier for my patients again. And it gives you another avenue of perhaps making money too, because now you're selling capsules. Not everybody has capsules at home. They don't want to go buy capsules. They don't even know what capsules to use. So it gives you an avenue to provide another service to your patients. I like to buy the 00 ones and I like to buy the vegan, so there's no issues if they are vegan and they start questioning where the capsules came from. So I personally have had a hard time buying a lot of capsule makers. I'm not sure for some reason, but I have 2 and I hold those like gold because I can't get too many that are simple to use. And I love education. And again, I feel like if patients are educated and they understand why you're recommending an herb, they're going to believe you and they're going to take it and they're going to commit to your recommendation. So from that book, again, that clinical manual that I keep talking about, this one, I print out the formulas. I print out the information that they have in there and I hand it to the patient. So each time a patient takes a new formula, I give them the information on the paper. I give them the paperwork that talks about the herbs. So they can read about it. They see how it works as far as Western. They see how it works as far as Eastern approach. They can see the herbs are in them and they can see any type of nutritional things that they can do alongside of it so they can get better. So it's something that you may want to consider. Not everybody wants to do that. Of course, there's paper cost and you have to ink, you have to use the ink, but to me, that's the cost of business. And it's really important for me to educate my patients. So I always have a few extra paperwork, these packages of papers for every formula so the patients have it. If they used the formula already before, like let's say neck and shoulder acute, I'm not going to give it to them every time they take the herb. I'm only going to give it to them the first time. And it's very informative. And my patients have learned to really appreciate that knowledge because a lot of them want to get educated and they want to know what you're giving them. If you have limited space, but even if you don't have limited space and you start carrying herbs, whether in powder or in capsules, I love these bins. Those bins right there on the chart, on the PowerPoint, I buy them from that company called Uline, and that's the size that I use. I'll show you. It looks like this. Oh, actually, I wanted to show you. So this, I'm not sure you can see that, but this is the paperwork I give my patients. Like, for example, this is the one on Shine. I print it out from that book, and then it just has all this awesome information on it, and I just fold it up, and I just give it to the patient when they come take the herbs. They take the herbs, they take the paper, and it's so easy. This is the bin that I'm talking about. So it keeps things really organized in your shelf. So I'm not sure if you can see, this is the capsules from Evergreen. I mean, it fits perfect in there, but even if you want to carry capsules and you want to carry the powders are bigger. I mean, it fits perfect in there. So you could fit about 4 or 5 in each one of this, which is kind of my inventory. I always have 4 or 5. I don't like to carry too many of them. Like I said before, I got burnt out with throwing away herbs that expired. And I realized that if I buy 4 or 5 of each, I'm not. But if you're just starting out, 1 or 2 is plenty. But these bins have been lifesaver. It keeps them organized on the shelf. Even if you have a lot of shelving, sometimes they start tipping over or you knock them down. It just becomes a hot mess. Those bins will save your life and keep you organized and tidy. And in the front, they have like a little pocket here where you actually can put a little paper that says the name of the herb. So you could keep them organized in your shelf by alphabetical order. And then I had discussed this on one of the questions. Just be cautious when it comes to patients with blood thinners. I usually don't give them herbs. I know you can, and just in a very minor way, or give them a low dose, but I try not to. Just personally, I don't feel comfortable doing it. I was kind of scared. I'm not an expert in herbs. I'm still on this journey to learning more about herbs. So I kind of like to keep it safe. And I just tell patients that I can help them with diet changes, and that I can help them with acupuncture. And they seem to be okay with that. They don't want to be put at risk. But again, if you're an expert at herbs, then you definitely can, you could figure out the right dosage. But it's just some helpful tips that I've learned in the past that have helped me in practice. Let's see. Well, before I go to objections, let's go to some of the questions. So the question is there a formula for postpartum woman on lactation who needs blood building and energy boosting? This will be a great question for Dr. Tina, because I usually don't, if they're breastfeeding, I typically wait till the baby's about 6 months when they really can digest herbs. I'm sure there is something that you may be able to use to tonify them safely. Again, I'm not an expert in all the herbs, but like I mentioned in the beginning, something that I love about eLotus and Evergreen is that you can ask questions. They are willing to help you. You can email them, you can call. And I think I appreciate that about them because they're very patient with trying to help us that are not experts. Because I think we all want to expand in our business and help our patients naturally. And I think if we help each other, then it's going to help us, right? It's going to help all of us. So I would ask that question to Dr. Tina at Evergreen and see if they have a collection formula that they recommend. Again, I'm more cautious, and I try to, with patients like this, I try to just give them diet recommendations, and I do acupuncture, and that seems to work. But I feel safe after 6 months. If the baby is 6 months and they're still breastfeeding, then I feel safe to recommend the herbs at that point. Another question. Will Calm ES make one sleepy? So Calm ES does not make you sleepy. I've had that question before. If taking Calm ES is going to make them sleepy. So it doesn't make them sleepy. It just kind of, it unblocks the pathway. It kind of gets the liver to function better. It kind of gets rid of the anxiety, but not sleepy. So it's very safe to take at any point. I personally have taken it before. There's no sleepiness, at least not from me or what my patients have told me. I don't understand the one from Yixing Shang. I'm not sure what you're asking there. Okay. The other questions are herbal medicines or treatments cost effective than allopathic ones? That's a tricky question. It all depends, right? I mean, if someone has insurance and they don't have to pay for their doctor treatments, then no. If you have to pay for acupuncture and herbs, then there's a cost to it. It just depends what the patient wants, right? So if the patient wants to treat the root cause and they want to treat themselves naturally and holistically, then it's worth the expense that comes with it. So it just depends on how you want to see that question. Cost effective doesn't necessarily mean what's best for the patient. I'm not sure. I just realized that when I'm answering questions, I think there's a button that says answer live. I'm not sure I have to press that or not. But the question was, are herbal medicine or treatments cost effective than allopathic ones? And again, the answer may be if the patient has insurance and they don't have to pay, or they only have a copayment, then that will be the least expensive route to go. But it all depends on what type of care the patient wants. If the patient wants to treat the root cause, or they want a natural recommendation, then if they have to pay for acupuncture out of pocket or pay for herbs, then they might have to do that based on what it is, what the results are that they want. And the nice thing about natural medicine is that you don't have to take the product forever and ever, and you don't have to do acupuncture forever and ever. So it doesn't mean that they're going to have to be taking those herbs for for 10, 20 years, like you take a prescription drug, like for blood pressure. So it might be investment initially for 1 month to 3 months if they need to do acupuncture herbs, but it isn't lifelong, and they actually address the root cause. So they have to weigh what's more important to them, address the root cause or just address the symptom long-term. So most patients want to address the root cause and they want to address their body naturally. And it's up to them to do that, because sometimes insurance doesn't want to cover natural medicine. So it really is based on your approach and what you're looking for. The question is men's ease also healing or only analgesic? I have found that let's see. So the question is men's ease also healing or only analgesic? I find that once I have patients start taking it, plus the acupuncture, they really stop having less issues with cramping or clotting. And so I find that it's actually healing them and not just a pain reliever. So it allows blood to flow better, stop the cramping, some circulation improves. So I think long-term, it actually may be healing the issue and not just, it's not like a Tylenol or ibuprofen, actually alleviates the problem from the root cause. So if I have to say, I would say it's actually more healing. Another question, any formula for older patients who do not have UTI, but have dripping urination at night only? Daytime urination is normal flow. I'm not sure if there's one in the collection formula that I know of. So that question might be good for Dr. Tina, Dr. Chen, and see what they suggest. Yeah, because if it's not a UTI, then you can't use the V support. Okay. Someone else asked me what book I was referring to. This is the book, The Clinical Manual of Oriental Medicine. And this is from eLotus. It's from the Lotus Institute, and it has all the collection formulas of evergreen herbs. The other question is, are any of these herb formulas contraindicated with pregnancy? I personally do not use herbs when a patient is pregnant. The only herbs that I do use, they have a collection called Blossom 1 through 4. And I like to use Blossom 1 and Blossom 2 mostly, and that you take before ovulation, before they try to conceive. And I personally feel safe using those before they have ovulation. So after they try to conceive or once they're pregnant, I personally don't use herbs. Again, there's a lot of masters at herbs that probably do and they feel safe with it, but I personally don't. And it's something that you have to educate yourself and feel comfortable if you are going to do that. Another question is, can you recommend the name of the capsule maker you use? I don't remember the names. I have 2 of them. I've only been able to find them on Amazon, but every time I go back on there, I can't find them. So just a capsule maker that holds the 200, the 00 capsules, that's the ones that I use. And I buy the 00 capsules and I put 100 of them in a little bag and I sell them to the patients in the little baggie. I sell them the capsules, and then the capsule maker has to make those capsules, right? So you have to find a capsule maker that fits those capsules. So capsule maker that has 00 size, that's what I use. I don't have a name for them. And again, I've had such a hard time finding them, but if you could find them where you live, then that's great. Get a few because they're not easy to find. I have another question. What's the recommendation for wrist pain from tennis playing? Evergreen has a formula called arm support, and that one's a really good one for wrist, elbow, shoulder issues. And that's the one that I would choose. And I will combine that one with the formula for analgesic formula, because that one's can help combine with that with the arm support. I didn't bring this one up because I don't see enough patients with wrist pain. And since I was trying to keep it simple for you guys who want to start with an herbal pharmacy and don't know where to begin and want to keep it short as far as inventory, and you don't want to spend a lot of money, I don't use the arm support one very often. Usually I find that if I do acupuncture, it helps it, and that kind of seems to work. But again, if you have wrist pain and you want an herb, then it's called arm support, and I will combine that with the analgesic formula. It's called herbal analgesic. Another question is, can you please share if you've noted any relationship between patient compliance in taking the herbs and their demographic, social, economic background? Yes and no. I mean, I think if they're in a tight budget, they're going to have some issues if you have them on herbs for a long time, so they may not comply. What I do with patients who cannot afford the herbs, I have them just do herbs and not do acupuncture. So if they have to choose one or the other, I have them just do the herbs because they're there for treatment, right? So they're going to be able to afford something. So I help them with that case. I think I haven't found a specific demographic that takes herbs better than others. I think it's based on your confidence of recommending it to them. If they trust you, if you have a good relationship with them, if they feel like they're being heard and you're listening to them, I think that relationship is already building. So they're going to trust you and they are going to take the herbs. But as far as, other compliance will have to be financial. If they can't afford it, that's what I try to do. I try to just do one or the other, or I try to do less so they can afford the treatment because I know they're going to get better. And my goal is always to make them better. So I always work around something in order to get that result. So the last question is from Alzalda. I have a cash practice, so everyone pays out of pocket. Most of my patients are self-employed or cannot arrange their schedules to see doctors for multiple times. They come to see me, get a treatment, get herbs, and feel better in one visit. They consider the savings of time to feel better to outweigh any insurance advantage. And I agree with that. I also have a cash practice. I stopped taking insurance many years ago. Personally, it became a hassle for me. And then when I had staff, it became too much work to have insurance. So my practice is all cash. The only insurance that we do take right now is workman's comp because I have a heart for them and I feel bad that they're in pain. And I know that if workman's comp can pay their acupuncture, then I'd rather see them than not see them. But patients do prefer to pay cash when they're getting the right care and they're getting better quicker, and they could get in quicker too. They don't have to wait months to get something in. So patients have no issues with paying cash if they know that they're going to benefit from it. All right, so I've gone through all my questions so far. Let's finish this presentation. Let's see. Okay, so as I promised, here are the objections that my patients have. They tell me that's a lot of capsules daily, right? So once you give them the herbs, once you give them the herbs and you tell them you have to take 4 3 times a day, or you tell them you have to take 7 3 times a day, or you have to tell them you have to take, 6 to 8 every 4 hours, they kind of freak out. They're like, wow, that's a lot of capsules. And I always agree with them because they are right. It is a lot of capsules, especially if you're used to taking a vitamin. You take 1 vitamin a day and you're done, or they take a prescription drug and they take 1 prescription for their blood pressure and they're done. Giving them 12 capsules a day is really shocking. They're like, too much, right? So I always agree with them. You have to agree with them because they're right. They're 100% right. It is a lot of capsules. But I always explain to them that if they open it, there's not that much powder. So it's going to take 12 capsules or 16 capsules, whatever it is that you're suggesting, to get the right dosage. So they need the right dosage to get the right results. I'm like, if you're going to go take a Tylenol, you can't take a quarter of a Tylenol and expect to have the right results. So they have to take the right dosage. If for some reason they say they don't want to take that many capsules, then I just tell them, open up the capsules, open them up into water, and then just drink it, because that way they're eliminating the capsules. But this is where having powder herbs at the office can help too. If the patient does not want to have the capsules, then they can have the powder. You eliminate some of that objection right off the bat if you actually carry them in both, and you can ask them right up front, do you prefer capsules? You're going to have to be taking 12 capsules a day, just an example, or I could give it to you in powder form. And although it doesn't taste very good and it's very bitter and it's yucky and they have to chug it, you give them the option because they have to comply, right? They got to get better one way or another. And again, I always tell my patients, those herbs do not work unless you take them. So let's figure out how you can take them. You're going to drink them, or you're going to swallow the pills, or you're going to take the powder. Sometimes they ask if they take prescription drugs. Will it be safe to take together? And the answer is, it is safe to take. I personally always have them do it an hour apart. I don't have them take it at the same time of any prescription drugs, because I don't want their prescription drugs to have an interference with our herbs. I don't want our herbs to actually interfere with any of the prescription drugs. So I ask that they always take it at least an hour apart. And that should usually take care of the problem. And, sometimes they're concerned with the herbs and what's in the herbs and are they safe? And that always makes me laugh, because most of them are taking prescription drugs that have so many chemicals and side effects, and they don't worry about those chemicals or their side effects. But if they start questioning your herbs, or are they safe, or what's in it, I just go ahead and I always print up the herbal formula from that book. Or if I'm giving them, if you're doing single herbs or you're doing other Chinese formulas, I print out the information from the book and I just let them have it. Most of the time, they're not even going to understand it. And I try to tell them that, this is based on Chinese medicine. It isn't the same as Western medicine, but if you want to know what's in it, here it is. They deserve to know. If they want to get educated, you could command them for that because they should learn. But sometimes their doctor wants to know what's in the herbs, but the doctor isn't an herbalist. But I still give it to them and just let them do what they want with it. But it is okay to take prescription drugs along the herbs, because I always tell my patients, herbs are like food, right? They're like food. They're barks and trees and all this stuff that is actually like food, right? So it's food that has medicinal benefits. So food is safe. There's no chemicals. There's no issues with that. There's usually no side effect, especially if you're prescribing the correct herb. There's not going to be an issue. It's food. So there's no prescription. It's not like a prescription drug. So again, education. You got to educate your patient. Educate them as much as you can. Listen to them. Make them feel heard and validate them, because if they don't feel validated and they don't feel like you're listening to them, you're going to lose that trust that they have in you. Once they trust you, they won't question anything. They'll just do it because they know that you're on their team and you want to help them, and you're knowledgeable enough to guide them in the right direction to give them the results that they need. Another objection that I found throughout the years is, I'm already taking something for this issue. Well, if they're already taking something for the issue and they're seeing you for that issue, is because that drug is not helping, right? So they're there for a reason. They need something else. So acupuncture sometimes is not enough. So you have to give them something else. I always tell them, the herb works differently, right? The prescription drug is like going on one route. And I would say that the prescription drug is going one route and the herbs are going another route. So they're working different. They're not even working, they're working completely different. So I always tell them it's okay to take two things, your prescription and take an herb, because we're trying to address the root cause and we're trying to get long-term results. We're not just trying to mask the symptom. So it's okay to take them both. It's working totally different. Sometimes patients want to get off their drugs or they're being weaned off a prescription drug. Then it's even better to give them something as an herb, because the herb is going to get them ready. So when they get off that prescription drug and they wean off it, the body is already balanced. So they're not going to have that withdrawal, or they're not going to have that symptom come back like a vengeance, because now they're having an addiction from the prescription drug. So it's okay. It's definitely okay to take herbs and their prescription drug, even though they're taking something already for the issue. Let's see. The next objection is the herbs hurt my stomach, or I have a sensitive stomach. And you'll see that a lot. You know, herbs are very bitter. I think I'm not sure if everybody here from is Western or not, but our digestions are not very strong. They're very weak. Our diets have really hurt our digestive system. And we've done a lot to make it weak, right? Kill our digestive fire with all the eyes. We have all these chemicals, all these toxins, you name it. The list goes on and on. So our digestions are not very strong for herbs. So they can hurt their stomach, or they may have a sensitive stomach. So what I always tell them is try it after a full meal. I prefer them on an empty stomach, but if they can't take it on an empty stomach, I tell them to have a full meal and then take the dosage after. Usually, most of the time, that takes care of it. There's no problems with that. But if they still complain that it still hurts their stomach, or it makes them queasy, or their stomach is sensitive, then at that point, I start cutting back the dosage. Let's say I said 5 3 times a day. Then I tell them, I don't know, I tell them to do 4 3 times a day. Or I tell them do 3 times a day, 3 times a day. You almost have to play with that number. Every patient is so different. Sometimes I've had patients just do it 1 time a day until they're like, oh, okay, I can handle that. Then I start using. I've had patients where I have them do 1 capsule once a day, which is like nothing. And I have to work them up to it. But again, you're there to work with them. You're trying to help them. You're trying to understand them and give them options so they can take these herbs. So it's okay if their stomach is sensitive, or, or they think it's going to hurt. You can work with it. You just got to be patient with them. And if you're doing acupuncture, just make sure you're tonifying their stomach so they can handle these herbs better. And make sure that they're not drinking these herbs with cold water or ice water or anything of the sort, because they're not going to digest well. They're not going to dissolve in their stomach. So that's another thing. Make sure that they're not drinking ice water or drinking these herbs. Even in capsules, make sure they're not cold water. Make sure they're not with any type of things that are very cold. Especially if you are doing powder herbs and you're making them do a tea, of course, you got to tell them it's room temperature. I've had patients want to do it in cold water. I'm like, you can't do it in cold water. It doesn't blend. It doesn't blend well. It's not going to digest well. So that's something else you could eliminate that will hurt your stomach. Okay, I forget to take them 3 times a day. I hear that all the time. They have such a hard time remembering to do something 3 times a day. They've been so geared to doing a prescription drug or taking their vitamins just once a day that 3 times a day is, you're asking so much of them. So I mean, there's different ways, right? They can set reminders. I tell them to put their herbs in a baggie and put it in their pocket, put it in their purse, take it in their lunchbox. Sometimes you feel like you're like their parent. You got to teach them how to remember these things. And if they still can't, I'm like, set reminders on your phone. I don't know. You have to remember. You got to take them 3 times a day. And if they still cannot do it, then I have them do twice a day. Then I have them do more on those 2 times. I'm like, okay, if you remember the breakfast one, then do a little bit more breakfast. And if you remember when you're at night at home, then do a little bit more. That way you're still kind of getting close to the right dosage. Because again, if they don't get the right dosage, and you have to tell them, if you don't get the right dosage, you're not going to see the improvement that you're looking for. So they have to be part of the solution. They have to do what they need to do. You can't go there and make them take it 3 times a day, but I have found that that works. So tell them to take a little bit more at breakfast, take a little bit more at lunch or at dinner, whichever 2 times they remember the most. Have them do it those 2 times, a higher dosage, and that way you at least know they're getting close to the right quantity. And if they're taking powder herbs, I do the same thing. I just tell them to do 1 more little scoop in the dosage that they're doing, 1 or 2 more scoops, and it gets close to the right dosage that they need. Another question is, are they safe? Where do they come from? Are they Chinese herbs? I get that question too. And I know, I can't remember where it is. It's from eLotus or Evergreen themselves. I want to say it's Evergreen. They have something that you can print out that says all the inspection that they do to make sure that those herbs are safe when they come in, and that they're actually, there's no toxicity in them, there's no chemicals, there's no heavy metals, or their inspections are rigorous. And I know that, and I've been using this company for many, many years because of that, because I feel like they're safe. You're getting the actual herb, right? So you're not getting skeleton herbs, which means that there's no benefit. I wouldn't be using these herbs for so long if I didn't get results, right? So to get results, they have to be really good herbs and they have to be safe. So sometimes they'll just listen to you as you say that, you know, that yes, the company goes through intense inspections to even get them to the country. And they come from Taiwan, if I'm correct. If I'm not, forgive me, but I'm almost sure they come from Taiwan. So they come from a safe place. And again, the inspection is amazing. And sometimes they'll take your answer and that's it. They don't want to question it. But if you feel like they still need a little bit more of an answer, or they don't feel quite safe with taking herbs, then I just print out the information from the herb company itself so they can have it and they can read about it. And they can, they can call the company they want and they can ask more questions sometimes if they need to. They've never had to, if I just give them that handout, but most of the time they trust you at this point. But you always tell them, if they don't feel safe with taking the herbs, they don't have to take the herbs. You give them options, but herbs have been around for so long. They are food that have medicinal benefits. So the lack of, the issue with that is really minimal, if any at all. And then let's see. Will I have to take this herb forever? Will I have to take this forever? And the answer is no. I think they're afraid because there is a cost to it. And they're used to taking their prescription drug for whatever it is, their thyroid or their blood pressure. They're used to taking this forever, and they know that there is no end in sight. They will take that herb, they will take that prescription drug till they die. So they're concerned because now you're asking them to pay for herbs, and they're concerned if they can even afford this forever. And you have to tell them right away, no, it's not forever. And that's because we're treating the root cause. We're not treating the symptom. If you were treating the symptom, you will have to take it forever, because once you stop treating it, you stop taking the prescription or you stop taking the product, the symptom is going to come back. So we're addressing the root cause. Everybody's different. I always tell them it's going to take a month to 3 months, maybe longer, but everybody's different. Usually within a couple of weeks, if they're taking the right formula, they are going to see results. And that's what I tell them. Give it at least 2 to 4 weeks. If you see some relief, then we're going to continue. And then little by little, we're going to start spacing you down. That gives them hope that it's not forever and that you are addressing the problem. And some patients don't want to get off after they're all feeling so much better. They just want to take like a couple little spoonfuls or even just take 4 little capsules for a long time because they feel like it's still helping them. But that's their choice at that point. That's not your recommendation. If they want to, it's safe to do it. I always tell patients, if you feel better, you're only taking a little bit. And if it continues to help you, you could take it longer, but you don't have to take this forever. So you could get rid of that fear because it doesn't have to be something that discourages them from starting the herbs. If they know there's an end in sight and it's only for a little bit until they correct the problem, then they're going to be more prone to taking them. And again, I keep I keep emphasizing this. You got to educate them in a nice way. You got to talk to them. You got to put yourself in their position and understand where they're going to, because these are very good objections that they have. And if they're going to be a good patient, they're going to be compliant, then they're going to have to feel that you understand them and you give them a good answer. Because if you don't give them a good answer, they're not going to stick with the recommendations. And it's too expensive. I've heard that. So it can be expensive depending on what herbs you're doing, what herbs you're recommending. If you start blending herbs, it could get more expensive because now you're putting 2-3 formulas into one bottle instead of just selling them one. So you got to explain what that is too. You got to explain why it costs more money to do a formula than it does for the simple formula of one bottle of capsules. Let's say one bottle of capsules, or if I make a formula, I'm putting 3, 4, 5, sometimes I put 6, 7, not that many, but sometimes I put 3 or 4 formulas. So that's going to add up. It's still cheaper, I believe, to go with a formula in powder than it is me giving them every formula in capsule. So once I explain that to them, I'm like, one bottle of capsules, something like this. I don't know, right now I sell, I think $30. That's going to last about a week or so. That's, if I start giving you 4 of these that you need, that's going to cost you like $120 for a week or so. That gets expensive. But if I start blending them into powder, that's more cost effective. And it's cheaper too, depending on how much you want to charge. But if I make a blend of 4 powders, then if you start explaining to them the cost, and although it seems like it may be expensive, it's actually less expensive than if I did it this way. And they're going to understand. If they understand, they're going to comply. Again, they have to, if you confuse them, they're not going to comply. So another thing you could tell them is, it may seem expensive right now, but it is treating the root cause and there is an end in sight. You're not going to have to do it for a long time. So that gives them choice of like, okay, I can commit to this for a little bit, or maybe I'm not ready right now, but I'm going to commit to it soon, whenever it is. But at least you have to tell them the price, and they have to know how much it's going to cost them so they can budget for it. They can commit to it. Maybe they have to put in a credit card, or they just have to cut back on other things in their life in order to get better. But if they're trying to heal, they're trying to treat the root cause, it's worth it because they're seeing you for a reason. That means they couldn't get answers anywhere else and they need results. So it's worth paying for the results if they're not healing anywhere else, in a sense, So that's my last objection that I have heard for many, many years in my practice. And now I don't have any problems when patients come up with these objections. At first, it was a little hard to come up with the right answer, how to even explain it to them. But now it's very easy. And now when I get them, patients all comply. They comply to the formulas, they comply to the recommendations because you have given them an answer that works and that makes sense to them. And then they're going to become a better patient. Let's see. Do you guys have any more questions? Let's see. So I have another question. What formula would you recommend for cancer patients? So, in our practice, we don't typically address cancer per se. So there's not one specifically for cancer. If the patient is coming in because they're really fatigued or they're really tired from their treatment, then I like to use Imperial Tonic for that overall fatigue that they're going to have. Sometimes if they're getting chemo or they're getting radiation, sometimes their prescribing doctor does not want them to do herbs. They don't want them to do anything else. So you got to make sure that it's okay with them too. So they do what their doctor's recommending. So I don't have one specifically for a cancer patient. Again, we don't treat cancer per se. We treat the root causes of patients. And that's something else that is important with our profession. It's safe because we're treating the body as a whole. We're not treating a symptom. We're not treating a named diagnosis. We're actually treating what's causing the patient to have that symptom. So we get away with less. We have less issues because we're not treating a named condition like cancer. We're really treating the body as a whole. So most of the time the patient is really tired, again, fatigued. You know, they have kinds of nausea and all kinds of stuff from their treatment. So I would recommend Imperial Tonic, but there are probably other formulas too. Again, you could always contact the herbalist at Evergreen or eLotus and kind of take some courses from other seasoned practitioners and see what they recommend. Do you guys have any more questions? So the other question is there any formula for enlarged prostate? And the formula that Evergreen uses is called P support. That's P as in Peter, and it's called support. That one is their formula for enlarged prostate. And that seems to work too. Sometimes you have to use combination of formulas. Sometimes one is not enough. But if you go in their book, you see if your patient is having any other symptoms, then you can see if there's any other formula that you can combine. But P support is their formula that is specifically for enlarged prostate. And again, you got to do some diet suggestions. You got to do other things that can help them. And acupuncture in combination is excellent. So both acupuncture and the herb will make a big difference. It's not something that is overnight, but it can start giving them symptom relief for sure. Let's see. Let's see. So you guys have any other questions? So GI Harmony and GI Tonic. I usually use GI Tonic more when they have a spleen deficiency. In GI Harmony, I find when they have more like Western diagnosis like IBS or diverticulitis, or really, to me, when they're more deficient, I use the GI Tonic. When they have more of just that bloating, that's when I personally like to use the GI Harmony. I'm sure there's a better use for them, but in my practice, that's when I have used it. Again, if they have any type of weakness, I love the GI Tonic, or deficiency overall. Otherwise, like I mentioned, I keep saying it, but I have found that GI Harmony is just really great when the main complaint is when they have bloating. Let's see. I hope you guys have learned a lot from this. And I'm not sure if there's any more questions, but I still have time if you want to answer more questions. I hope that you have found this useful and beneficial, and that you feel that you can start incorporating this into your practice, or you feel the confidence to start doing it now, even just addressing your patients. Let's see. Trying to see if there's any other questions that I haven't referred to. Let's see. I'm reading your chat. Thank you so much. I'm glad you guys have learned, found it informative. And again, if I could have helped you make this process a lot faster and easier, I think that would be great. Because it took me a long time. So you guys continue to grow and continue to do well. And let's be purposeful in helping our patients do better naturally with this amazing medicine. So lots of thank yous. You're very welcome, guys. All right, guys, thank you so much
Thank
again.
you, Dr. Laura, for a wonderful class filled with clinical pearls. And also a big thank you to all of you for joining us today and choosing eLotus as your CEU provider. If you enjoyed today's class, we'd love if you could share your experience on social media to help promote both our speaker and eLotus. As a reminder, the CEU quiz will be available the next work day, and I will email you when that's ready. Thank you again for joining us today, and we will see you guys all at our next webinar on March 15. Autoimmune Disorders and Depression, Dr. Jimmy Chang's Herbal Master Sheet, in which you will learn to master differential diagnosis and herbal prescription. That's it for today, you guys. Thank you so much. We'll see you next. Bye.
Bye.